Carrie Billman. I have worked at the Johns Hopkins Hospital for 20 years. I just had my 20th anniversary in February of 2024. I started there as a baby nurse, working on the floor, working in pediatrics. In 2015, I moved into the field of infection prevention at Johns Hopkins. I also joined our Biocontainment unit team. I really started there just as a participant and started running what is called our trained observer program. So they're kind of safety officers that specialize in infection prevention and keep our healthcare workers safe while they are caring for high consequence pathogen patients. I became more involved with the education of the staff members caring for these patients and with the NETEC organization. I recently got promoted within the Johns Hopkins Health System to the Director of Education for the Johns Hopkins Special Pathogen Center and Biocontainment Unit and got my Master's in Health Professions Education. So that really helped motivate me and guide me towards the Director of Education role I have today. I wanted to take on more leadership roles. I wanted to be able to do, bigger projects and be in control of kind of advancement within my own career. I've always loved education. It was a big part of what I did when I was on the floor, taking care of patients and educating newer nurses. And it was a big part of what I was already doing within the biocontainment unit. But in order to be a leader, be seen as a leader, and be able to be promoted, I really needed to have a higher level degree. So when I discovered the MHPE program at Michigan, it really had all of those things. It allowed me to grow within the role I already had. It allowed me to be a nurse leader, but a nurse leader that was educating all different levels. So it was a perfect fit for me. And it was really exactly what I needed at the time and really led me to where I am today. I had a few concerns. It had been a really long time since I'd been in school. So that was a huge concern. I had already said that I was never, once I had my degree and I was a nurse, I was never going back. Obviously things change. So there were some concerns just in having to be a student again. That's definitely something that is different. I think the other concern I had was finding the right program because it seemed great based on, what was online and how it was packaged. But I didn't know anyone who had been in the program. So, and certainly not anyone who had that degree through University of Michigan and being settled in Baltimore, Maryland. One thing that really also gave me concern is it seemed to be very geared towards physicians educating physicians. And once, Dr. Greppen gave me my interview and he was like, no, we need more nurses in this program. We need, more diversity. It's not just for doctors educating doctors. So I certainly could have looked, and I did look at MHPE programs at universities that were close by, ones that I could maybe get to in person easier. Johns Hopkins University had one, and it really wasn't a great fit because they wanted you to be a doctor or they wanted you to already have a master's in order to take the program. I'm like, but I'm trying to get a master's. I don't have one because I want one. So it was definitely something that, kind of stood in my way. But at the same time, I liked the idea of going through a school of medicine. I liked the idea of the other students and kind of folks that were in my cohort that could provide other sort of, expertise that would just complement what I was learning as opposed to kind of get in my way. And really, I loved the fit in this particular organization. It just seemed very, very cohesive and very broad in the scope and the learners, but at the same time, it wasn't a large group. So I didn't feel like I was going to get lost in the shuffle at Michigan. I felt like I was getting one-on-one personal education. I was assigned a mentor right off the bat, and that was something that was huge in helping me through the program, that kind of one-on-one individual attention. The idea that anything that I was already doing could be applied to the program at the same time, and basically just explaining why I made the choices I made and what I may have done differently and being able to use my experiences, not only sharing them with a broader audience who may have not heard of some of the things that I was doing, but also utilizing things I was doing while learning at the same time was super attractive to me. I have educational opportunities that come my way literally every day, both small, big time projects. I wasn't reinventing something. I didn't have to go out and necessarily look for things to write up, to do, and to educate on in order to meet these competencies. These were things I was already doing, which worked just fantastically with my work, my life, work-life balance in general. That lecture-based kind of testing-based approach doesn't necessarily allow for as much flexibility as a competency-based approach. I was told in the very beginning, you can kind of get this program done super quickly if you're able to continue to submit competencies and EPAs as you go, or it can stretch out a little longer if you need time in between those projects and to be able to balance work, life, and school at the same time. And that is definitely what I did. I stretched out quite a few years, and it was able to, by doing that, I was able to get the degree, but at the same time, not feel like it was getting in the way of my personal life, getting in the way of the projects I had to continue to complete at work, the extra hours I was working for when we were within the pandemic, things like that. So I think I mentioned my mentor before. She was instrumental at making sure I didn't put it too far to the side, that it was completely out of my periphery. She just made sure very gently that I was still moving forward, even if I was moving forward slowly, that I was moving forward. And she is really a big part of how I made it through the program. I needed to be at more of a director level, which I couldn't be without an advanced degree, and one that certainly focused on education. So this really helped push me towards wanting to do that. The role itself was designed for me. So I came and said, here's what I have to offer. Here's my background. I have a background in nursing, infection prevention, education, a master's degree in education for health professions. And I would like to be the director for this area within the hospital and within the Johns Hopkins system. So that role was designed for me when I came to the table with what I had to offer. I learned different ways to educate. I definitely kind of made it a more of a full package. And by saying that, I mean, I'm able to really assess what the learner already knows, what they need to know, and really the evaluation of how adequate was the education that I've provided. It's far easier for me to feel like I can reach all those different levels within the hospital system. I really make sure that the education is tailored to them and is useful. It's not going to be something that is over their head. It's not going to be a click-through learning module that no one's actually reading. It really helped me kind of hone in on what works for healthcare workers, and not just one type, but everyone across the board. I did not expect really that one-on-one level of help that I was provided with Dr. Greppin, from Dawn Harris, from my mentor, Dr. Marty. It really was fantastic to feel like if I felt overwhelmed or lost or too much or didn't know where I was supposed to be headed, that was an easy path. I had people to reach out to. The subject matter experts that they provided were fantastic at giving feedback. And a lot of times I thought I was on the complete wrong track. And, the people that were there as resources were fantastic. Anyone who is not a physician but considering the program, they absolutely should. I think that the merits of the education process and kind of the group meetings that we had as a cohort was fantastic. It's so diverse. There's so many different professions that are using this to really advance their careers, and it becomes a huge benefit to get all of their different educational kind of opportunities, reading about what they're doing and hearing about how they apply the concepts completely differently than how I would approach them. Being able to get an advanced degree within exactly what I was looking for. I was able to tailor it to exactly what I needed it to be. I didn't just need a master's. I didn't just need something in education. I needed something that was going to actually help me educate every person that I came in contact with that I really needed to in different ways. I think that was a huge benefit for me. Take advantage of every opportunity that you're given through the program. Definitely listen to everything your mentor has to say. They are an invaluable resource. Definitely give yourself some grace. It's not a program that's designed to be done quickly. It can be, but give yourself some grace if you are like me and trying to balance being a full-time, working parent as well as a student at the same time. So it can be done. It is an amazing accomplishment. It feels really good when you're done, but it's a lot of fun on the ride there.